Coming up tonight, the Ministry of Scientific Research receives authorization to produce chloroquine, adopted as treatment for coronavirus. Minister Madeleine Twente says they have the know-how. Students at home begin receiving lectures on the state broadcaster before they will be authorized to return to school. Just what our government's plans, Minister Nalova Lyonga is our guest. And all Cameroon's 10 regions, with or without cases, battle to stop COVID-19 spread, as instructed by the government of the Republic. The details now. Thanks for watching the 7:30 news on CRTV. I am Moki Edwin Kinzaka in Yaoundé. The Ministry of Scientific Research and Innovation has the technical, material and human resources capable of fabricating the necessary palliative treatment drugs for COVID-19 in the country. The Minister of Scientific Research and Innovation, Dr. Madeleine Twente, gave the assurance today in Yaoundé in response to an authorization her ministry received to produce chloroquine to treat COVID-19. Killian Dandifon reports.
With some progressive 700 coronavirus cases confirmed in Cameroon today, the Ministry of Scientific Research and Innovation has welcomed the decision of its technical counterpart of public health with an authorization to produce chloroquine.
We have the equipment, we have the staff, we have the laboratories. In short, we have everything it takes to fabricate chloroquine. In 4 years, we have recruited 748 young researchers.
J'ai recruté depuis 4 ans à peu près 748 jeunes chercheurs.
But there is a problem of raw materials for the fabrication of chloroquine, which Cameroon does not have.
Ce qui manque actuellement dans le monde entier.
The only thing that we don't have, like all other countries across the world, are the raw materials, which are only found in China and India. Fortunately, we have excellent relations with China. It is true that we have to think and work in synergy with other government departments, but China can supply in 2 weeks if we had placed an order.
The Scientific Research and Innovation Board is eager to flatten the curve of coronavirus in Cameroon as soon as possible.
Our intention here is that by the time we get to the peak of the virus in Cameroon, we should produce our medication in the country.
The ministry has demonstrated that it can produce 200 tablets of chloroquine a minute and close to 900 per day, a capacity which can handle an overwhelming situation.
One of the ways the government of Cameroon is trying to limit the propagation of coronavirus is by refusing private clinics from quarantining confirmed cases. But with the rapid spread of the virus and pressure on structures authorized to handle the pandemic, there are fears patients may want to rush to private clinics. So what happens when a case walks into or is detected at a private clinic? Yoti Kaleli-Songe reports.
Working in synergy with government when faced with a suspected COVID-19 case at a private clinic is the only option.
No confirmed case actually is kept in private center.
We're not very allowed to leave them here because they can infect other people and get other people infected. So what we do is we play our role as much as possible to isolate them and to take care of them.
In this clinic, for example, more than 10 suspected cases of the coronavirus have been reported and confirmed since the disease made way into the country.
When it's a suspected case, what we first of all do is to isolate the patient. So we take the patient out because there are tents we have made for the patient, for patients who we consider to be maybe infected with the COVID-19. So we take them out, we place them under the tent, and we have now to call the 1510. We call them, and usually they don't waste so much time. They come and take the test they have to do.
Confirmation is by laboratory testing. So they will take the sample and send to the lab. As soon as the results is available, at that time it's no more the clinic which calls, because at that time we have the results and we are tracking for the result. So as soon as we have the result, we just organize for the transfer of the patient. He needs to get care in the centers that are dedicated for that.
Those confirmed in Yaoundé are then either quarantined at the central, General, Jamo, Jungola hospitals, or the Olembe isolation site. When in contact with anyone suspected of having the coronavirus, the drill is as much the same for health personnel in private clinics as it is with everyone else.
Traditional practitioners insist that claims that some of them can treat coronavirus are unfounded as the cure is yet to be discovered. They advise the population to rather go to hospitals in case of suspected symptoms and not rely on traditional potions. Victor Siga reports.
This market close to the Yaoundé railway station is renowned for the sale of medicinal plants like aloe vera, ginger and other herbs that citizens swear can cure the most dreaded coronavirus. Many traders of the herbs say the purchase of their goods have significantly increased with the confirmation of coronavirus cases in Cameroon. And they strongly maintain these plants can help infected persons of coronavirus. Traditional practitioners have distanced themselves from such allegations.
That's misleading the public. So it's better that somebody who is sick should better go for a treatment. That's why I'm telling you that as far as this pandemic is concerned, it is using some diseases that were already there to fight the respiratory system.
The naturalists say they have been at work to find a cure for this disease totally new to science, and while waiting, the population, they advise, should respect measures put in place by the government to combat the COVID-19.
Government directives to close all business establishments at 6 p.m. every day to check the spread of the coronavirus are not being respected by some business persons. However, police patrols along the streets of Yaoundé have served as a deterrent for some, while those found guilty of disregarding the measures have been warned about sanctions they will be faced with. Gilbert Ongene has been trailing the police. His report.
This is Bata Lonkak neighborhood in the heart of Yaoundé. It is 8 p.m. These people have disrespectfully transformed this Billy drinking joint into a beer parlor in defiance of the measure in force which demands that such places be shut down as from 6 p.m. every day.
I'm very surprised at the behavior of these young people. When we have a common enemy like this coronavirus, I expected them to abide by the measures put in place by government in order to stop it from spreading. But I am very disappointed with their attitude. Some of them even take drugs.
This defiant behavior, however, would not prosper as the security forces are always there to ensure that measures prescribed by the state are implemented.
Instructions have been given since for them to stay at home from 6 p.m. But as you can notice, many of them are still stubborn. They don't want to go along with the instruction of the hierarchy. But we are there to make sure they respect that instruction.
Earlier on, at the Briqueterie neighborhood, still in Yaoundé, these roast chicken vendors, provision store owners, and this lady who runs a snack bar restaurant are busy with business as usual, unperturbed. Gendarmes on patrol use persuasion and at times force to oblige them to shut down their establishments. As the saying goes, the law is hard, but it is the law and must be respected by all without exception.
Distance teaching for secondary school students has been launched on CRTV on all CRTV platforms. The close to 2-hour exercise at the state broadcaster, that is the radio house in Yaoundé, was launched in the presence of Secondary Education Minister Professor Nalova Lyonga and the Director General of CRTV, Charles Ndongo. Cynthia Etim was there.
On hand to welcome the Minister of Secondary Education was the Director General of CRTV, Charles Ndongo. They are working hand in gloves through the teleteaching program with the goal to enable students catch up with lessons that ended prematurely in the second term. For close to 2 hours, Professor Nalova Lyonga witnessed live the teleteaching exercise.
The medium is new, both for the teachers and for the learners. As a first, it is excellent. And I would like also to congratulate CRTV. They have done a wonderful job.
The minister has assured parents and guardians that students of each class in secondary schools will be opportuned to partake in the distance learning.
We're going to give the timetable so that everybody will know when there will be classes for them. Minesec is doing for all the classes. Sometimes when there is something on the screen, it is not read. Well, somebody who doesn't have vision, how will he or she know what you're doing? We have to think of students in that category.
Day one of this exercise was reserved for troisième students of the French subsystem of education, focus being on the teaching of sciences de la vie et de la terre and mathématiques. Those of the English subsystem of education will begin theirs on Thursday, April 9, as from 10 a.m.
We have been joined in the studio by Professor Nalova Lyonga, Cameroon's Minister of Secondary Education. You're welcome, Madam.
Thank you very much.
It's nice to meet you, Prof. Now, how do you evaluate the first day of the distance teaching and learning? I saw you were there with CRTV management.
It's very, very good. I think both CRTV and the teachers have done excellently well. As you know, they are all doing this for the first time. Teaching by CRTV is not the easiest thing for anybody. And so I've been trying to train the teachers for about a week and a half now. And I think they're doing very well, beautifully well. Congratulations to CRTV.
And of course, there are some complaints about those students in the rural areas who have no access to television, they don't have access to radio, and at times they don't have access to electricity.
Well, the problem is that Cameroonians are very much in a rush, and I don't blame them. But what they should know is that there are multiple media that they can use. Television is not the only means by which we broadcast the lectures, because there is YouTube, there is even WhatsApp, there is even Minpostel. There are all those media. And so they are going to get their lecture from all those media. If you don't get the lecture today, if you don't get it at the time when CRTV is airing the lectures, that is not you have not lost anything, because the lectures are there on the social media, positively speaking, social media, and they can get those lectures again. And I believe that CRTV will repeat some of those lectures. So it's not as if once you don't get the session on CRTV, you're lost. No, that's not it. We knew that we had different kinds of students, and we have taken good care of those students, including those who do not have electricity at all, because the written materials will be available in every regional center.
Oh, good news for them. Now, let me read this release that you signed with your colleague of Basic Education. It reads, the Minister of Basic Education and the Minister of Secondary Education kindly inform the educational community that during this COVID-19 pandemic period, decisions relating to the running of the education sectors are exclusively taken by the Prime Minister, head of government, under the very high instructions of the head of state. Consequently, the texts that are currently disseminated in the social networks in this regard are of no value. Parents, pupils, and students should therefore wait for the government's instructions. It is signed the Minister of Basic Education and the Minister of Secondary Education. What motivated this release you sent to us, Madam?
Well, I'm sure you have seen it because it was read on CRTV. And it's a pity that it has gone around so much, because that should not have been the text to go around. We did not stop lectures, and we are not going to uplift the ban. It is not our place to uplift a ban. It is the Prime Minister and the head of state who uplift the ban. And so whoever took that to the social media, I don't know what he thought he was doing.
Was it a document that was duly signed by Professor Nalova Lyonga?
It was. If you look at it there, can you see that the signature on that thing is a photocopy? It is a photocopy. And the Minister, Etundingwas, is an authentic, it's the original copy. Have you seen it? You should see one document with two different signatures. What is that? What does that mean? Where did he get the first one? Where did he get the second one? And why do you have two different signatures on the same page? What indeed was he trying to arrive at? I don't know. Because everybody wants to go to school. Everybody wants to know that the ban is off. but it is not the ministers to put a ban or to uplift it.
It was authorized by the Prime Minister and the head of state. So we presume they should be the ones to...
Exactly.
Now, what are the various scenarios for a new school calendar now that you said the 20th is not really very true?
Well, I cannot say it. You cannot say it. We don't know much about the virus. You cannot predict when it is going to be over. But the person who said that we should close the schools for very good reasons, who has always shown that he protects the children, that is the head of state, saw at a certain time, he and the Minister of Health, that it was necessary to close the schools. So this will happen. It will be uplifted at the right time. And the right time is not to be determined by the education ministers. The education ministers will simply work on the calendar to see if they say that we should open, when exactly would it be? All of this is hypothetical. We don't know it yet.
And Professor, before you leave us, how will examinations, especially end of course examinations, be written now? We
cannot tell. That again is hypothetical. Because if they say start school today, everything is going to go back to normal.
If it is not back to normal, we may have a blank school year.
You cannot have a blank school year, because before the schools were closed, we had almost completed the curriculum. So there was nothing, we have not lost anything. Those who were slow to start had covered about 60 to 70% of the curriculum. Those who started normally had reached about 80% of the curriculum. So we have lost nothing. But what we are doing now, and for this I say congratulations to the teachers, because they have continued to engage their students in the regions. You know, and so what is happening is that we're going to engage the students and try to cover the other 20%, which is really not necessary. But if we have to, we'll do it, and if we have time, we will do that.
Professor Nalova Leonga, thanks for coming. But, Madam, you're not leaving us yet, because I want us to go to the east region of Cameroon, where a case of coronavirus has been discovered. It concerned a 29-year-old man who was in isolation in Betua, the regional hospital there, since Sunday, when he was stopped from traveling to Mora in the far north region of the country. We have details with Tala LT.
Put up so far by Governor Gregoire Vongo and officials of the health domain to prevent the population from the COVID-19 pandemic, the deadly coronavirus has successfully found its way into the East region. The first victim recorded is a young man aged 29 who has been in confinement at the Betua Regional Hospital since Sunday. He was identified at the entrance to Betua on his way to Mora in the far north region from Douala. The results of the sample that came from Yaoundé this Wednesday afternoon confirmed, unfortunately, that he has been infected by the coronavirus. He is presently receiving treatment at the Betua Regional Hospital, but the great concern now is to identify the boss and the passengers with whom he traveled from Douala.
The first COVID-19 patient in the East region today is doing well. I can say that because we have seen him this morning, and he looks better than on Sunday when he arrives here.
Disturbing enough is the fact that he was discovered at the checkpoint at Bonis after having been pushed out of the public transport bus by some passengers who noticed he had some visible symptoms of the coronavirus.
The governor of the Adamawa has reiterated that people should ceaselessly respect basic hygiene habits and social distancing to stop COVID-19. Kildadita Gekebuka visited popular sports markets and prayer houses today. Raketu Musa Njingi reports from Ngaoundere.
An ecstasy of fumbling depicts the market situation and travel agencies visited by the Adamawa Governor Kildadi Tageke Bukar and some living forces of the region to evaluate the level of awareness of COVID-19 pandemic in the region.
The fifth time that we are out just to tell the population that the situation is so very serious. To be very frank, I think those measures are relatively implemented in our region. So far, the population have not carried out an appraisal of the situation. You can see people without going without washing their hands, wearing the mask, and people are not very conscious of the fact that the pandemic is out.
No water, soap or hand sanitizer could be found at some market stands. The government measures put in place to curb COVID-19 in the country is still to be welcomed by most Gaundare inhabitants. Shocked and perplexed by the way people are going about their activities in Gaundare, the governor gave an ultimatum to all who falter.
C'était simple de marquer soit à la peinture avec quelque chose pour démarquer les 1 mètre pour que vous puissiez salir.
Meantime, others are struggling to adhere to rules and hygiene measures put in place and to adapt to the new way of life imposed by the pandemic. For its teaching time, saves 9.
A cross-section of the population of Marua has made it an obligation to wear masks in an effort to stop the spread of the coronavirus. Sylvester Atemkeng reports from Marua.
It is over a week since the Minister of Public Health in one of his tweets recommended face masks to all as a measure to curb the spread of the coronavirus in the country. Meanwhile, the Minister of Transport in a recent press release also urged passengers to have their masks on before embarking on any journey. In the same vein, some public offices in Marua have, however, made it an obligation for all workers and visitors to have their face masks on before stepping into any office.
In our station, it is an obligation for all the workers and visitors to wear the mask before entering the building. And it is a collective effort for us to help the fight against coronavirus.
Some public offices and transport sectors have also purchased face masks to all their workers and visitors to ease the implementation of these measures.
These barrier measures have been taken by all our staff. I think we are going to continue to monitor them, to tell them the necessity of following the barrier measures, especially keep washing their hands, putting their masks.
While others have hit to this call, others are still reluctant to join the trend. The fight against this pandemic, nevertheless, involves everybody, and it is only through collective action, such as following the measures prescribed by the government, that the country will be able to contain the virus.
Travel agencies in Yaoundé have reduced the number of passengers they transport per bus and imposed hand washing with soap to stop the spread of COVID-19. Lekeatu Getuda Songanzi has the details from CRTV Center.
Of water with soap and hand sanitizers are some of the items that will welcome you at the entrances of most travel agencies now in Yaoundé. The managers have put in place certain rules and regulations aimed at curbing the spread of the coronavirus.
There's a bucket outside for the passengers to come and they wash their hands before they pay their ticket. Those who are walking are also well prepared before taking money from the passenger that we have already treated ourselves. The instructions, it is also very followed by the customers, because when they come, before they enter the vehicle, they have to wash their hands.
Drivers, on their parts, are ensuring that these prescribed measures are respected.
All the patrons have first of all reduced the number of the population that will carry inside the vehicle. Because my vehicle carries 75 places. Now we carry 50 in the place they try to expose themselves. And secondly, we have tried all the passengers that are entering the vehicle to try to put masks on their nose and their mouth. And when we are traveling in the night, let them try to open the window, let air be coming in. They should not lock all the windows, people should be breathing.
Putting an end to the coronavirus pandemic to owners of travel agencies in Yaoundé is now a top priority.
An online application to enable people to acquire medical information on COVID-19 has been created by a group of youths in Douala. The application, known as Corona Track, provides a chat room between people and doctors to detect cases and provide assistance. Madon Kwele reports.
The Corona Track online application is a technological innovation created to curb the propagation of the COVID-19 pandemic in Cameroon. The brains behind this initiative, these young Cameroonians in the fintech domain, have as main objective establishing dialogue between persons and doctors. The
The main idea is to create contact between doctors and patients. Besides that, the app does a brief online screening for persons to talk about their symptoms, whether or not they can worry, and help avoid psychosis due to lack of information.
The geolocalization is a concept also made available on this platform to provide ample information to its subscribers.
The geolocalization concept on the application enables one to know how many people are infected in an area. Some people wouldn't want to reveal their real identities, as such can connect with a pseudonym which doctors will use to follow them up.
These youths intend to completely develop this prototype as soon as possible.
We have started working with a team of medical experts at the Lakentine Hospital for the chatting system to be done 24/24. We invite other doctors to contact us for the success of this application.
The Corona Track online application shall be made available on Google Play Store in the days ahead.
Cases of coronavirus in Cameroon have increased by 45, taking the number of COVID-19 sufferers to above 700. We are going to get an update on the situation in Cameroon with Rahanatu Sali, who is at the Cameroon Health Emergency Operations Center. Now, Rahanatu, you've been there following up, and we know officials had to grant a press briefing by now to give an update. What is the situation like, Rahanatu Sali?
Good evening, Moki Edwin. Welcome to the Yaoundé Public Health Emergency Center, where we've been told that 17 new cases of the COVID-19 have been confirmed today. Yesterday, we were counting 5 affected regions in the country, but today we are at 6 already. The addition here is the East region, where 1 case was confirmed earlier today. With me is Dr. Viviane Amel Gomba. She is Chief of Service for Outbreak Preparation and Response in the Ministry of Public Health. Good evening, madam.
Good evening, Sally.
Now, we know Yaoundé is the epicenter of this pandemic, but can you tell us what regions out of the 6 affected regions have the most number of cases?
The region of Center is the leader with the number of cases because we have 415 cases of confirmed cases in the region of Sinta, followed by the region of the Littoral, who has 255 cases. The third region is the West region with 51 cases, followed up by the South region with 5 cases and the Southwest region with 4 cases. This evening, we registered 1 new case confirmed in the East region. So now we have 6 regions that are affected by the pandemic of COVID-19.
Now, once an infected person recovers from the coronavirus, is there any possibility of that same person getting reinfected?
Yes, of course. We observe in China and South Korea some cases that was cured, that recovered from the COVID-19, but that have been reinfected. Yes, it can be the minority, but it exists. When I say the minority, is about 15% of case. So what people should retain is that the barrier measures are very important. If you have recovered from the disease, you should continue to observe the barrier measures because you are still at risk. And if you have never been sick, if you have a negative test, you should continue also to observe the barrier measures.
Now, if an individual comes in contact with an infected person, is there any preventive treatment that individual can take without necessarily rushing to the hospital?
There is no scientific proof of the efficacy of a preventive treatment when you have been in contact with a confirmed case. So prophylactic treatment doesn't exist nowadays. What you have to do when you have been in contact with a confirmed case is to observe a quarantine. This quarantine will long for 14 days because this is the incubation period. And during this quarantine, you should follow up your temperature to observe if the occurrence of fever, but you should also follow up other signs and symptoms like cough, like breathing distress. And if you have any of these symptoms, please call the 1510 because there is a team, the rapid response team, who will be deployed to manage you.
Thank you very much, Doctor, for your availability.
Okay, thank you, sir.
Well, Moki, though the figures keep rising, the good news is one more person recovered today from the COVID-19, making it a total of 44 recovered cases in the country. Well, that's the latest update from this end. Back to you in the studio.
Thank you very much, Ranatu Sally, and please keep safe as we are keeping safe also in here. Now, Italy has not recorded any new infection or death case of coronavirus today. As the country continues to lead the global death toll with over 17,000 people, the United States of America now counts more than 400,000 persons infected. In the meantime, South Africa is ranked first among the affected nations in Africa with over 1,749 cases. Romeo Kenyon now presents the global situation of COVID-19 pandemic as of this evening.
The United States of America now tallies 404,056 cases of COVID-19. As of press time, Donald Trump's country had recorded over 3,721 newly infected people with about 12,988 deaths. In addition to these figures, more than 147 new deaths have been recorded today. According to report, Black Americans have been the most infected lately. Second on the log is Spain. The European country has booked 146,690 cases, with newly infected figures standing at over 4,748 plus 510 new deaths. No new cases or death numbers have been recorded in Italy this Wednesday, but the country continued to lead world's death toll with more than 17,127. At a time Germany and France complete the list of the 5 most hit nations across the globe, South Africa, for her part, is classified highest most affected country in Africa with 1,749 infected people. The nation is yet to record any new or death case this Wednesday. Algeria, Egypt, Morocco and Cameroon constitute some of the hit-hard countries on the continent. Like South Africa, the nations were yet to record any new or death case when this report was aired. In all, the number of coronavirus cases recorded across the globe stands at 1,455,520. Death toll 83,664, and the number of people recovered is 309,825.
The Senate has adopted the bill authorizing the reorganization of the Economic Community of Central African States. The bill was adopted during a plenary chaired by Senate President Marcel Nyat Njifenji today. The House is equally in the process of adopting 2 other bills which focus on improving the management of social welfare and the maritime transport on the international waters. Christian Chatham reports.
Bills number 137, 138 and 139, sent by the National Assembly 2 days ago, are now in the process of receiving the official approval of the Senate. The 3 bills, which were scrutinized by the Foreign Affairs Committee of the Senate, are now being presented in plenary to get the full endorsement of the House. Senate President Marcel Nyat Njifenji has been presiding over the plenary session. The bill reorganizing the economic community of Central African states has already been adopted. It was defended in plenary by the Minister of the Economy, Alamin Ousmane May, who was accompanied on the occasion by the Minister of External Relations, Lojin Mbela Mbela. Both officials spoke extensively about the bill, which they say will empower the ECAS bloc economically and open fresh perspectives for imports and exports. At the time of this report, the other bill authorizing the President of the Republic to proceed with Cameroon's accession to the International Convention for the Management of Ship, Ballast, Water and Sediments was being defended by the Minister of Transport. He says it will be an important instrument in monitoring international maritime traffic. A third bill, which focuses on the improvement of social security on the continent, is also scheduled to be put up for adoption at the Senate tonight, and will be defended by the Minister of Labour and Social Security. As the first legislative session for 2020 continues, members of the Senate are scheduled to deliberate on the bill to improve the postal system in the country on Thursday.
Inhabitants of the Northwest have praised the government for setting up a structure to reconstruct their region after it was devastated by separatist conflicts. They say they expect hospitals, roads, schools, and their homes and markets to be given priority in the reconstruction effort. Mabel McKenzie Sarkem reports.
Government envisaged huge sums for the tarring of the ring road, an infrastructure that covers 6 out of the 7 divisions of the Northwest region. But the socio-political crisis halted construction, and portions of the tarred road at Wainama along the Ndop-Kumbo axis, worth over 25 million CFA francs, destroyed. The bridge at the boundary between Fundong and Bafmeng, worth over 300 million CFA francs, has also been destroyed, amongst other bridges. Several water and electricity-related installations in the region, amounting to over 300 million, have also been vandalized. Many are those who expect the total reconstruction of these projects.
In the domain of Jukwa, the bad state of the road, that is really bad. We have suffered a lot.
Many schools, especially in the rural areas, have been destroyed. Some health infrastructures have also been vandalized.
By GSS Konda, GSS Njikwa, doctors have been displaced, no accessibility, social goods they are absent.
Back in my village, in Du, schools have been burnt. Right now like this, all my cousins are no more going to school. So we are pleading on the government whether they can renew the schools.
Batbo has 22 villages and nearly all those villages have a secondary school. And all are closed down. So we really pray that all those schools should be reconstructed.
The stalemate in the region has left many homeless and traumatized. Many people need new homes as well as financial and psychological assistance to start all over.
That ends the 7:30 news on CRTV. Join Aden Bala at 8:30 for the news in the French language. I am Moki Edwin Kinzaka in Yaoundé. Thanking you for watching.
CRTV News, ici, toute l'info.
CRTV News, nothing but the news.